A question about something that happened today, Dr. Fauci. The president said that the FDA will fast-track antiviral treatments for patients with coronavirus, saying that an anti-malarial drug would be made available, and he said that the drug would be made available almost immediately. When the public hears that, and obviously there's a lot of interest, a lot of hope in this, how much confidence should we put in that? And do we know that that drug would even work? Because, as you know, FDA Commissioner Hahn, he didn't go that far.
No. So let me put it into perspective for the viewers, and perhaps we'll understand it better. There is a drug, two drugs. They're very similar. Chloroquine, hydroxychloroquine. They've been used for decades for malaria as well as for the treatment of certain autoimmune diseases like lupus. It's a very inexpensive drug. It's tried and true. It's been around for a long time. There's been anecdotal, non-proven, anecdotal data that it works. When people give it to someone, it makes them better. But when you have an uncontrolled trial, you can never definitively say that it works. In addition, there's been some in vitro data in the test tube. You put hydroxychloroquine or chloroquine in with the virus, it tends to impede the virus. It's done that with a number of other viruses. What was said today at the press conference, this is an already approved drug. So it could be available, for example, when you use it off-label, which means somebody uses it for a purpose that it wasn't officially approved for. What the president was saying is that we're going to look at all of these drugs and we're going to try to get them available in the context of some sort of a protocol where you just don't distribute drugs willy-nilly. You may make it more accessible than you would have previously, but you do it in the context to at least get some feel for both safety and whether it works. That was the message about the malaria drug, hydroxychloroquine and chloroquine.
I mean, the reason we ask, obviously, Dr. Fauci, about this, and it's constantly this balance, I imagine, in your job and everyone's job, this balance between hope and honesty. I mean, it was described, as you know, at the press conference as a game changer. I mean, again, how should the public interpret that sort of thing?
You know, Sanjay, I'm not so sure it was. I mean, I was watching it on TV. I was, around the corner from the conference looking at it on TV. I don't think it was necessarily described as a game changer, but let's make sure people understand what it is. Today, there are no proven safe and effective therapies for the coronavirus. Okay. That doesn't mean that we're not going to do everything we can to make things that have even a hint of efficacy more readily available, so long as you do it in the context of some sort of protocol that would take a look of getting some information about safety and efficacy. But there's no magic drug out there right now.
Okay. I just want to, Mr. Anderson, just want to put it in non-doctor terms because I'm not very smart. People should not go to their doctor and say, I want chloroquine because I hear that may work. Is that correct?
Yeah, that's correct. I mean, I think if you would want it, if I wanted to use chloroquine or hydroxychloroquine, I try to do it in some sort of expanded access clinical trial as opposed to just going. People are going to do it anyway. But, I mean, as a matter of principle, to just go out and say, prescribe this for me, what that would do would probably deplete the supplies for the people who might need it if it shows to be working. I mean, that's one of the real, I think, unintended consequences of everybody out there flooding, trying to get the drug.
So, Dr. Fauci, Mayor de Blasio announced today that New York City is expected to run out of medical supplies in 2 to 3 weeks. I spoke to him last night. I just want to play a bit of what he said and have you respond.
What I'm really deeply concerned about is medical supplies, and then beyond that, even other basic supplies that people need in their lives. But the medical supply situation, Anderson, you're talking about ventilators, surgical masks, surgical gowns, really basic stuff that we're deeply concerned about where we're going to be in a few weeks. And here's the problem. The federal government is absent in this discussion right now.
What about that, Dr. Fauci? Is the federal government absent in the discussion, and what can a city do?
No, I spoke to Mayor de Blasio today by phone, and I understand he has a significant problem that he's trying to address at the local level and is looking for some federal help. I mean, right now, if you look at what's going on, there's a strategic national stockpile in which there are at least 12,700 ventilators in there, as well as tens of millions of masks. That may not be enough. So what the federal government is doing, and it isn't just the federal government that needs to do it. It's got to be also local states, private industry, and others working together with the federal government. But what's being done right now, as you may have heard, that the president is tapping the Department of Defense to get many more ventilators into the stockpile so they'll be ready to use, as well as doing things like getting more masks. About beds, that's important. One of the ways you can obviate the problem of beds is to do something that's been suggested strongly. To the best of your capability, put off and cancel elective surgical and medical procedures, because many of those procedures, as elective as they are, they consume personal protective equipment like masks and gowns and gloves and things like that. So if you do that, you're not going to completely solve the problem, but you'll help mitigate the problem. That's one of the things. The other things is that we have a couple of naval ships, the Mercy and other ships that can be there, that can then come by, and one is coming to New York, and then free up beds that you could put non-coronavirus patients there to free up beds. Again, it isn't the absolute solution to what is a problem. I get calls all the time from my colleagues in various places saying it looks like they're running out of equipment. We've got to meet the challenge and do as best as we can to be able to fulfill the needs.